Hey, everybody. This is Dr. Gibbs. I am so excited to be here with Dr. Janice Brown. She is a PM&R physician and has a really unique skill set for managing chronic pain. And I am excited to introduce you to her and her to you. So tonight we are going to talk about all things chronic pain and particularly as it applies to people with hormone disorders. But welcome, Dr. Brown. It's great to have you here.
Thank you, Dr. Gibbs. I appreciate it so much.
Well, tell my audience. So you are board certified PM&R, and then you also have certification in functional medicine. So why don't you just kind of introduce yourself and say where you came from and how you got interested in what you're doing now.
So yes, thank you again for being on your show. I it's a roundabout way, but in a nutshell, I do have board certification in medical acupuncture as well as functional medicine. And what drew me to it is, I think for me, just knowing that I can help people with chronic pain. It kind of started off when I was 15. My mom had back pain and, as a kid growing up, it's not, at least in our household, it was unusual to see my mom, down in the bed and sick. She was always doing something. She was always up and about. And so, when she hurt a back, I think it was just a back strain. I don't know where the idea came from. I decided to massage her and she got better. And I was like, oh, that's cool.
Wow.
And yeah. So what's kind of unique about me is I didn't take the traditional track when, I'm going to medical school. I did not go straight from undergrad to medical school. I actually took time off 6 years. And in that time, I actually became a massage therapist. So I learned a lot about touch, about the tissue, about the body, about physical body. Learned some really great techniques. That's at the school that I trained at in New York City. At the time, that school no longer is in existence, but at the time that I went, they had an acupuncture school that was part of the massage school. And that's kind of how I learned or heard about acupuncture because coming from St. Croix, no one ever mentioned acupuncture. I don't even think acupuncture was offered on the island. And so,
wow.
Yeah. So that's kind of was my introduction. I learned shiatsu, which is a form of body massage that takes into consideration the same meridians that are used in acupuncture. And so it was kind of like an introduction because I had to learn those meridians and it was cool. And I just said, you know what, at some point I'm going to do it. And I did. When I was in residency, I took the Helms course and decided to do acupuncture. And every job that I've been at since graduating residency, I basically told them, I said, I'm going to work here and I'm going to do acupuncture. So I basically just told them that and I've been doing it.
So that is really awesome. And so med school at Rutgers, residency at UPenn, board certified PM&R, and acupuncturist and functional medicine and shiatsu. That's amazing. That's so cool.
Yeah, busy. And kind of to answer your question with the functional medicine piece, growing up in St. Croix, my mom, it was passed down from, to her from her grandparents or her grandmother actually, just kind of how to heal and what kind of herbs to use in the Caribbean. We're big on using all kinds of different herbs and spices. And some of it is influenced by India. We have some of that cultural influence. And so it was just very common for us to just go out in the backyard and, we would pick some leaves from a plant or from a tree and then use it oftentimes in the form of a tea. We're big tea drinkers. So I growing up, we were rarely sick. Of course, lots of fish poisoning because we ate a lot of fish.
Oh, no.
Yeah, my first fish poison, I was like 2 years old. I still remember, 2 years old, just bending over. But anyway,
Oh my goodness.
Yeah. Outside of that, we were pretty healthy, and my mom understood the importance of making sure that we got good exercise. We were out in the sun all the time, eating well. We ate a variety of food. Sure that we gave us supplements. We took vitamins as well as fish oil. That was something that we grew up on. Making sure that we stayed away from anything that was processed. Sodas,
Mhm.
we drank sodas. Candy was like considered a treat for us.
Yeah.
Um, so yeah, so I kind of grew up that way. And then, in just in terms of like treating people and trying to figure out how to improve their lives, sometimes you come to a roadblock and it's sometimes frustrating because you don't have the tools to be able to treat that. That kind of led me to seeking out functional medicine because I wanted more to be able to treat my patient.
Sure. All right. So talk to us a little bit about some of the different kinds of chronic pain that your combined technique especially good for, and maybe walk us through a little bit of how you would start with somebody and what you would focus on to help them.
Okay, so one perfect example is fibromyalgia. I do see a fair amount of those patients.
Mhm.
In this, we do have rheumatology, and oftentimes when they cannot treat them, there's no, joint disease, there's no
Mhm.
specific arthritis. They oftentimes will send them to us. And so for me, what I would do is, obviously get a history, try to get a really focused history. One of the things in functional medicine that we learned in terms of history taking is to ask about food, what they're eating,
Oh,
ask
yeah.
about childhood. Yep, really important. Their childhood events, any adverse childhood events that they've experienced, where they grew up, if they were exposed to, any specific chemicals, pretty much asking about their exercise routine. And that's something that, in my PM&R training, that's something that we automatically will do as well. But exercise, sleep, how much sleep they're getting. I take them, kind of like a comprehensive, just trying to get a feel for, how they're living their life. In addition to knowing what medications, I also ask them what supplements they're taking. And I want people to be, kind of open with me. Because a lot of times people do take supplements, but they're afraid to tell their doctors because,
Seen that a
yeah,
lot.
mhm. Because I think that they feel as though that it's not a medicine or it's not relevant because it's not prescribed. But I remind anything that enters your body will create a chemical reaction, no matter what, whether it's food, vitamins, supplements, drugs, doesn't matter.
Yeah. No, you're
So,
absolutely right.
yeah. So I get that history. And then most of the time, fibromyalgia does not do well with opioids because I do pain management. I do prescribe opioids, but they just don't do well because more or
Hmm.
less what I find with fibromyalgia, it's their nervous system just has not shut down. It's constantly in this on state. And so therefore it just keeps signaling that that person has pain. They have pain and
Hmm.
it could fuse. Oftentimes I find that it's in the muscles. And so when I do a physical exam, I'm looking, for any neurologic deficits. So I'm going to check their nervous system. I'm going to check their musculoskeletal system. I'm going to check to see if there's any atrophy in the muscles, any dysfunction in the joint, any swelling, any tenderness, any changes in the skin. When it comes to changes in the skin, sometimes when you do as an acupuncturist, sometimes we look for that because that'll give us a clue as to how long, especially if it's in the part of the body that hurt. So, I try to look at everything and of course, getting vitals, looking at their, what their bodies, their autonomic system, because it gives us an insight into what's happening. And then, kind of like going over what they've been treated with before. If they need to do imaging, if they've had any imaging studies, I will look at that. If they've had like x-rays, I'll take a look at the x-rays. If they've had MRIs, scan the MRI. And then
Yeah.
at the end, depending on, where they're coming from, because, I can't force everybody and says, hey, why don't you do the natural way? And let's start changing your diet and let's get supplements on board. I can't do that with everybody.
Yeah. They look at you like you're crazy. I imagine if you start too much and you're not.
Exactly. Yeah.
Yeah.
Oftentimes they'll look at you like you're crazy. And then, of course, you have to be mindful of, some people may not completely understand. I mean, I've had a lot of, because that's the other thing is I see traumatic brain injury patients too. Those who, may have that diagnosis for fibromyalgia, I have to take into consideration. They may not completely, understand or comprehend, the reason or my approach. So I kind of try to meet the person where the expectations are. If the expectations are for medication management, like oral pain medications, I talk about that and I, try to, educate them as to what medications work versus which ones doesn't. Some of them may not necessarily be on the right treatment. So we talk about changing some of them and, so forth. For those who are open to taking a more holistic approach, like I'll have them do a journal of their, like a food journal, because I see what they're eating. And then we talk about like, some night changes. I usually just do one change at a time. People are dehydrated. They're not drinking enough water, nor are they getting enough specific minerals in their diet.
I was going to ask you about that. How many times do you see mineral deficiencies in those people?
Yeah, quite often. Quite often. I find that, for the most part, I think the other providers and that they're seeing are they're getting savvy in terms of making sure that they're on the right, supplements if it's indicated. But, it's not uncommon for me to, try someone and say, hey, let's get on some magnesium because, we know that that's needed in the soil. And of course, what we eat, oftentimes what we need, we get from food, which is why food is literally medicine. Sometimes we just don't get enough of the magnesium, and it's a great muscle relaxant and a mood stabilizer, believe it or not.
Oh, I believe it.
Yeah, it's true. And then the other things, of course, if somebody's coming in with fatigue, because oftentimes the fibromyalgia, they're oftentimes complaining of tiredness of fatigue. And so, maybe even checking, it's not uncommon for me to send them off and get, vitamin B12 levels, acid, or to make sure if I don't have those labs in front of me, hey, let's go ahead and let's just check some thyroids. And I know that's your kind of expertise, your area of expertise.
Yeah, that's my thing.
It's not uncommon for me to do that. And, with the functional medicine training, we know that we look a little bit deeper, not just at the TSH, but you're looking at T3, T4s, and as you know, even the reverse T3. Sometimes even at that. Yeah. But, it's so again, just going back to the original question, I just do a very comprehensive assessment, trying to look at everything. And I may not get through everything on that first visit. Oftentimes I may say, hey, we'll continue the conversation, especially if they're interested in, lifestyle, looking at lifestyle modifications. I'll address that at the next visit and subsequent ones. But it's usually about 45 minutes to an hour.
Yeah, it's a lot. Well, you mentioned childhood trauma, and also I'm sure that stress plays a huge role in what's going on with your folks. So can you speak to what that does, what childhood traumas or, young adult traumas or adult traumas plus stress does to people, and what you suggest that they do to try to reverse that and counteract that?
Well, this is a really good question, because this is something that I am absolutely fascinated with, and I'm actually creating a pain management program that targets this. So yeah. So when we talk about trauma, and I remind people, we've had one body. There's only one body that we have for the whole entire time that we're on this earth. And so everything that happens to us, emotional, physical, will manifest in the body. There is that book that is The Body Tells, I think it's called, I have it actually in my room. The Body Holds the Secret, or holds, I forgot the
Body Keeps the Score. Is that the one you're thinking of?
Score, yes. Thank you. That's a really good one. And what it explains essentially is that when we have like such strong, like emotional traumas, whether it's physical abuse, psychological abuse, verbal abuse, combined with traumatic events, whether it's an accident or something that, causes a change in the body. I mean, this is going to manifest in the musculoskeletal system. So, and so, oftentimes, the way I think about it is, for example, someone's been in a car accident, and that car accident, that force that went through the body was strong enough to break a bone. We all know, for those who've gone to medical school, we know, and you've done anatomy, that bone is super hard. It takes tremendous amount of force to break that bone. And so I think about it, and it's like, okay, the force went through the body, it broke the bone, but where did it go? Because forces are going to be transferable. So often it can still stay in the body and show up as pain, oftentimes. And usually in your musculoskeletal system, fascia, we can't forget the fascia is what overlies the muscle, and it's a very active and electronically active or electrically active part of the body. Because, I mean, through the fascia, the nerve runs, all the vessels, the lymphatic system. I mean, it's a very active tissue. So a lot of times that's kind of where what we think about the trauma and we think about the force, sometimes it gets stuck there. So, and so again, what it boils down to is the person just says, I'm in pain. I feel pain. They feel discomfort. And I try to get my patients, as well as my clients, my private clients that I work with, to really understand and define their pain. Like, really feel it. Like, does it feel sharp? Does it feel throbbing? Does it feel achy? Does it feel deep? Does it come and go? Does it migrate, or does it stay in the same place? So all of these questions, and these, again, when I do my intake, I try to get as specific as possible about the type of pain that they're feeling. So again, going back to the original question, the trauma is going to manifest in the body. You're going to feel it in some form or fashion, whether it's pain, psychologically. Sometimes it manifests, especially with the trauma, it can manifest in more psychological changes, bipolar disorder, schizophrenia. Yeah. So it can show up in many different forms. And so how do you deal with that? How do you kind of, I wouldn't say necessarily get rid of it, but how do you deal with it? How do you manage it so that it doesn't overcome, it takes over your life? And so that's where all the modalities come in. Diet, looking at your diet. What can you change to make sure that you're not eating foods that are creating more inflammation? Looking at exercise. What exercises can you do to calm down a nervous system? Acupuncture, is it a good fit for you to reset the nervous system? So that way that firing, pretty much of the nerves, it's not as intense. Okay. You're shutting it down, because you're more or less can be in a sympathetic state, which is kind of that fight or flight. Like, something is always going to happen. You're not resting, which is what causes.
So just for the audience, in case they don't know what sympathetic is. So sympathetic is not a good thing. Sounds good, but it's it's part of your involuntary nervous system that revs you up and makes you anxious and makes you ready to run or hide or fight. And so it's really important, if you've had any kind of stress or trauma, and even mental stress will rev that up. It's important to try to counteract that, and downregulate that to what's called parasympathetic, in order to be able to get away from the effects of that stress.
Absolutely. So so thank you for that explanation. I know sometimes we physicians, we're notorious for throwing out these terminology and not defining them. So thank you for doing it. But so, other techniques that people can do. And I often encourage people to take it upon themselves to be proactive in terms of managing their pain. And, meditation is a very good one. being silent, just kind of shutting the world out a little bit for periods of time, especially if you can do it daily, that would be excellent because that kind of helps too.
Yeah. And not with television.
Not with television, not with scrolling, not with the internet. No, true silence. And, again, that's where meditation, some people, they don't rush any, they don't really understand the meditation, but they may understand prayer. And so these are things that I talk to them about, giving them techniques, things that they can do on their own to help with calming down the nervous system. Yeah. And, it can help with your pain, actually.
Cool. All right. Well, you mentioned that you have recently started a coaching program for chronic pain management. So give us a little bit more deets about that. I'd love to hear.
So this idea came out of the fact that insurance, as you know, does not pay for a lot of things. And it's unfortunate, but it is what it is. It's the reality.
Yeah, they almost don't pay for doctors anymore.
Yeah. Well, I mean, we're in a state that we're in because it is what it is. I mean, we can go back in time and say, oh my gosh, the people, our doctors, our fellow colleagues who came before us, they screwed us over. And I've heard that before. But, the fact of the matter is we have to deal with what we have. And so what I am creating, and I haven't put it out there yet, I'm actually going to be doing a webinar in January that, highlight the explains what I'm going to be doing, and I'm going to get it really rolling out. But essentially, I work with people who are really interested in controlling their pain, really wanting to control their pain, not just getting pain medication, but truly getting it to the point where they can sort of deal with it and possibly get rid of it. And so my approach is going to be very similar to what I do, but in a much deeper layer. And it will include acupuncture if that's something that they want, as well as some of the body work to help with releasing trauma and some of that energy that's stuck in the body.
All right. So thank you so much for coming on with this. This has been Dr. Janice Brown, and everybody needs to please keep in mind that medical research and medical information is not always as black and white as people think. And that when we're making treatment decisions for individual people, we sometimes have to really take into consideration their individual styles and their individual problems. So this is not individual medical advice. This is for entertainment and information only. And if you have a medical condition, my advice is to please see your medical doctor for any condition that you may have. So this has been the Tuesday Live at 5:30. Thank you again, Dr. Brown, for coming. It has been a lot of fun.